Okay guys, it's Gus from Pharmacy Down Under. Just wanted to make a really quick video in terms of, tackling those cold and flu over-the-counter OTC case scenarios. This video is more geared toward those students that have already started preparing for the oral exam, but that just need some more material, hands-on material to sort of get their head around, what do you ask first? What's the logic of flow in terms of questioning, what to recommend where, how to structure your answers, and knowing when to refer and things like that as well. So there's going to be a series of videos. This first episode is going to be mainly covering cold and flu, because it's the seasonal, posting around the July time. So we're in the peak of cold and flu season. So I thought I might get us started on some cases that are surrounding cold and flu. Now, essentially, it's going to be a super basic 3 cases. We're going to start with a really basic one, then moving on to a medium case, and then moving on to a more advanced case. The whole point here is to really get your head around, thinking logically, asking the right questions, identifying red flags, and confidently explaining your reasoning as well. Now, getting used to this sort of formulation over time and practicing regularly will hopefully not just set you up for the exam, but also set you up for the day-to-day practice in community pharmacy. Now, before we get started, what I want to do is I sort of want to go through a rough sort of structure that I usually like to recommend for all my students. So I'll just move down. So in terms of structure, any OTC scenario, I always recommend following a very, very simple structure. You don't want to overcomplicate it. In the exam, time isn't on your side when it comes to these kind of cases, so you don't want to blabber on, you don't want to fluff around, you want to cut it pretty simple and cut it pretty straight to exactly what's required for the exam. So generally speaking, the first step, of course, will be establishing rapport. Now, establishing rapport is very, very brief. So introducing yourself, introducing the topic, introducing yourself as a pharmacist. If it's more of a sensitive case, you might want to recommend that you want to speak to the patient elsewhere, somewhere more private, whether it be something more about women's health or it might be about something a bit more sensitive. We must always consider asking that as a suggestion, just in case. But I always recommend students to say this no matter what the case is, just because it shows and demonstrates to the marker that you're not just coherent and understanding the clinical side of things, but you also understand the ethical things and understanding patient autonomy, in the sense that they have the choice to decide if they want to have an open discussion in public or they want to take it personal into the counseling room. That's what's going to allow you to become more socially mature and more emotionally experienced when it comes to these kind of case scenarios in the real life practice. Now, the second step would be, of course, info gathering. Now, information gathering can include your simple, what, stop, go, those kind of basic questionnaire structures. That's fine. But what I really want you to understand from this is not just to ask those questions, but to also to find context specific information. So, for example, we're talking about pregnancy, medications, family history, travel. So those kind of context-specific questions are really, really important because that's what's going to allow you to really dig deeper and hopefully get to the source of the problem faster. Because I've noticed a lot of students, if they follow just the simple what, stop, go method, they will get a lot of information, but I feel like they'll be limited in terms of getting into the solution or the root cause of the problem faster because they're not asking those context-specific questions that are what the markers are looking for. And step 3 is conveying solution clearly. So what that includes is explaining to patient what might be suffering from. A lot of students forget this. And it sounds basic, but a lot of them forget. So it's very important to explain to the patient what they are actually suffering from. So you are maybe suffering from a sinus infection or a sinus headache or allergies or a cold and flu. Because the thing is, you have to communicate to the patient what the problem is. You can't just be giving them medications and recommendations willy-nilly, because you sort of are not really establishing the fact that you know what you're talking about if you're not at least explaining what your suspicions and what your logic and reasoning is of giving that solution. So it's very important to say, you might be suffering from, bacterial conjunctivitis based off your symptoms, X, Y, and Z. And because of this, I'm going to recommend X, Y, and Z, use this X, Y, Z way, etc., and finish your counseling. Now, that's really, really important. Now, after that, the most important thing, after explaining to the patient what they might be suffering from, is to simply counsel on 1 or 2 recommendations. So, for example, we're looking at, like, for example, cold and flu. We'll do, if it's like more, we got head cold, fever, you have paracetamol, and then counsel for that. And then you'd have like a sinus rinse. You can go for 3rd and 4th options, but you've got to be careful of the time, and you've got to be careful of making sure you're counseling appropriately and not giving the wrong information in a rush. Because I'd rather you stick to 1 or 2 solutions that are safe and effective than to blab on about 3 or 4 just to show your knowledge. But in the rush of things, you stuff up the counseling and you actually run out of time. So generally speaking, just to be on the safe side, let's just stick to 2 really solid solutions, and expanding on them as much as possible. Now, the 4th thing as well that I think is really important, just a cherry on top when it comes to sort of really nailing these OTC scenarios, is non-pharm and lifestyle monitoring. So essentially what this means is we want to make sure we're counseling the patient on what to do if symptoms progress, and when to refer, and lifestyle modifications. So it's pretty self-explanatory, knowing what to do if symptoms progress. So for example, if there's a fever, it's constantly going up, still elevated, neurological symptoms, pregnancy, breastfeeding cases, usually best to refer in general. When to refer, that's of course is the most important. When to move on to hospital, move on to medical center, etc. And lifestyle modifications. So making sure we're using, humidifiers, making sure we're wearing masks, sanitation, things like that as well. So that's really, really important. So knowing that, let's get stuck into the cases. So we'll jump into case 1. So in this case here, we have a 25-year-old female presenting with a mild sore throat and nasal congestion. So let's write down the information we know. So 25-year-old female presents to the pharmacy with mild sore throat and nasal congestion. So in the exam scenario, that's all they will give you. They won't give anything more than that. It's going to rely on you to extract the information out of the patient in order to determine what to recommend. So I'll write down the key points here. So 25-year-old female with mild sore throat and congestion. Cool. Now, from here, we can ask your typical what, stop, go, no worries at all. Of course, keep in mind of her age and her gender. She's of childbearing age, so it's very, very important to ask if she's pregnant or breastfeeding. Very, very important, because that will definitely change completely the types of recommendations you'll be giving. But in this case scenario, after asking all the questions, the relevant questions, we've come to the conclusion that she has no fever, no meds, no allergies, and not preg or breastfeeding. Cool. So that's excellent. So this gives us a really good canvas to work with in terms of what we can recommend. So no fever, no other medications, no allergies, not pregnant or breastfeeding. So and then in terms of recommendations, she wants something that's going to allow her to get her back to work or back to her normal lifestyle, I imagine, because of her age, probably as a busy young adult. So what we need to think of is that how are we going to treat the sore throat? How are we going to treat the nasal infection? What are we going to consider? We're going to consider individual therapies, combination therapies. So we've got to look at the options out there. Now, we'll start with sore throat for now. Now, for sore throat, there are a ton of things available in the community pharmacy that are really good for this case. So there are lozenges, there are gargles, and there are sprays. So the ultimate goal of all of these lozenges in general will be to act as an antiseptic, to act as an analgesic, and to numb. So a very, very simple sort of three-pronged goal of all lozenge sore throat treatments. Now, there are some that do better jobs of this than others. So I'm a big fan of lozenges just because of the convenience, the flavor, and the sort of the doses that you're getting out of it are much higher and much more effective than a gargle. So some examples would be like Strepsils. We have Duratas, Difflam. And then we have gargles. We have, for example, the most famous, you have betadine and Difflam as well. And then sprays, we also have Streptofen, Difflam. So we have a few different options to choose from. Now it's a matter of figuring out which one do we recommend and how do we recommend it for the sore throat. Now, generally speaking, in this case, because there are no comorbidities, no pregnancy, no breastfeeding, no other medications, then it's really up to you. So you have full freedom to do whatever you like in this case. So there's no problem whatsoever. So if you do want to choose, for example, lozenges, that's fine. So we can go ahead with lozenges. Now, generally speaking, inside most of these lozenges, you're going to have things that are going to include a combination of benzdiamine with some lignocaine. So benzdiamine is like an antiseptic one, and then you have lignocaine as your anesthetic. So that combination is really, really good. Now, in terms of dosages for lozenges, so generally speaking, for most lozenges, we're going to go looking for usually like one lozenge you can do every 2 to 3 hours, generally speaking. Every 2 to 3 hours. Now, it's very important that patient is constantly moving lozenge in mouth. And to make sure that they keep swallowing actives. Now, that might sound a bit weird, but the reason why is that so many times patients complain that lozenges don't work. The reason being is because they're parking that lozenge in between their teeth and their cheek and sitting it there and like a lolly. But they keep forgetting that it's not a lolly, it's actually a therapeutic medicine. So by parking that lozenge in between their cheek, they're actually allowing the medicine just to seep into that tooth area and just numbing the gum and not doing anything else. So you want them to keep moving the lozenge back and forth and keep swallowing all the medicine that keeps leaking out of the lozenge in order to make the most out of that lozenge. Now, let's address the next symptom. So nasal congestion is the next complaint. So nasal congestion, there's a lot of options available. So nasal congestion, we're looking at things like oral solutions, We have nasal sprays. So when it comes to oral solutions, we're looking at things like pseudoephedrine, and phenylephrine. And then nasal sprays, you have tons of options like oxymetazoline. And you even have combinations like in Otrivin Plus with oxy and ipratropium, which is like a muscarinic antagonist. So these are the main combinations when it comes to like sort of your decongestants. Now, generally speaking, in terms of the data, pseudoephedrine is way, way better in potency compared to phenylephrine. But this one, phenylephrine here, is generally more well tolerated for most people, whereas in some cases this can have more of a mild stimulant sort of side effect and can increase blood pressure in some populations. So if she's generally healthy and it's all good, she can go for the pseudoephedrine option if she prefers an oral option. The dosage for pseudoephedrine, generally speaking, is 60 milligram. Every, it's supposed to be Q, 4 to 6 hours PRN as required. Now, pseudoephedrine, depending on the state, would needs to be recorded through Project Stop at the time of recording. So making sure we're having photo ID, making sure they're not getting it elsewhere, just to make sure that we're having appropriate and safe use of pseudoephedrine. Now, phenylephrine is just a Schedule 2, so that one's just available off the shelf, so no need to record that one. Now, nasal sprays as well. Nasal sprays are very interesting because I'm more of a fan of nasal sprays because they work more locally. So hopefully they target those symptoms a bit more aggressively and fast, as opposed to tablets that have to go through, first pass metabolism and everything like that before they really kick in. Whereas your nasal sprays work locally, which is awesome. The only catch is that, especially with these decongestant nasal sprays, we have one major side effect, which is rebound congestion. Now, rebound congestion is a result of overuse or misuse of these nasal sprays. So making sure that we're sticking to a very strict regimen. So what that means is we're doing, usually for most of these, depending on the formulation, it's going to be 1 to 2 sprays every 12 hours for a max of 5 days. So the reason why is that by using it for more than 5 days, you're going to increase the risk of rebound congestion. And of course, that means you're going to be falling back into the habit of using these nasal sprays again and again for a long period of time. Okay, so that covers case 1 pretty well. Let's move on to case 2. Case 2 is a little bit different. Case number 2. So in case number 2, we start with a 42-year-old male that has a blocked nose, sinus pressure, and is feeling really run down after a work trip. He started 3 days ago. Okay, so let's write down some information. So what we know, 42-year-old male, and he's got blocked nose, sinus pressure. I can see where this is going. Okay, and he's feeling run down. Okay, so after we ask a little bit extra questions, what we do learn after asking what's up, go, we learn that he has started 3 days ago with these symptoms. No fever. Has hypertension. Let me spell that correctly. Okay. Now, we also ask as well if he's got any other symptoms. He says he has a bit of facial pain. And he's got a history of sinus infections. Cool. So The stimulus starts off with just these main dot points, but then after asking the correct questions, which we'll go through in another video of how to contextualize questions, and we have a course about this in our PharmWise Skool community, which is in the description if you're interested. But in the meantime, what we can learn is that after asking the appropriate questions, we learn that he started 3 days ago, he's got no fever, he has hypertension, he's got facial pain, and has a history of sinus infections. So the thing is, we got some really, really integral information here that will really change the way we approach the solution. So immediately, just right off the bat, we're going to eliminate our pseudoephedrine oral options. So like in the other previous case, we used pseudoephedrine to treat because she had no hypertension issues whatsoever. This gentleman has a history of hypertension, so we're going to definitely avoid pseudo, as that can increase BP, contraindicated. Cool. Let's move on to the next option. So he's saying he's got facial pain, he has no fever, and he's feeling really run down and tired. Fair enough. Now, in this case here, what I would personally recommend would be a combination of a few things. Now, I would definitely recommend something like a sinus rinse just to clean out that congestion in the sinuses. So what a sinus rinse is essentially, it's essentially a bottle that has a special sort of soft plastic container. And essentially, we have to insert some sodium chloride in there. And essentially what that does is that when you mix that sodium with the water, all you're meant to do is that this nozzle is meant to go inside one nostril. And essentially, it clears out all the water by going up one nostril, clearing up the sinuses, and then out through the other. So generally speaking, it's a very, very awkward solution, but it does work really, really well. That one's going to hopefully release any pressure he might be feeling temporarily. What I would also recommend is if he has any sort of surface level pain because of that facial pain, I will definitely recommend something like just a paracetamol. And that one would be 1,000 milligrams every 4 to 6 hours, PRN, with a maximum of 8 per day. And just for the sinus rinse, we can do it 3 times a day. Okay, so that one's going to hopefully clear sinuses. And that one's going to help with facial pain. But what's solution number 3? In this case, because of the family history of sinus infections and because of the hypertension, I'm definitely going to be referring to GP. Why? Because 1, hypertension, 2, family history, and 3, he's getting run down and facial pain. Okay, now these symptoms are very broad, so they need to have a proper examination. To confirm diagnosis. Okay, so that one's a very special case where we, because of this, the context and because of the information that's been gathered after asking the most appropriate questions, we were lucky to figure out that this case needed to be referred on because of that hypertension and because of that facial pain as well. Cool, fantastic. Now, before we jump into the third and final case, just want to let you guys know that every week we do go through case scenarios like this on our PharmWise Intern community. So we go through case-by-case scenarios for the written and the oral exam. We go through quizzes, and we have a whole bunch of interns that are collaborating every day. So if you're interested and you are an intern and you do really want something to give you that edge, to give you that push to the right direction before your exams kick in, click the link and join the community today. There is a 7-day free trial if you're interested, just to have a look. All right, let's jump into the last case. Case number 3. So we start this case with a 67-year-old female presenting with a persistent cough, fatigue, and congestion. Okay, so 67-year-old female with cough, fatigue, and congestion. Okay, done. So then that's all the information you're given in the exam scenario. So after asking questions, so after delving into you learn that 1, she has had this for 6 days. 2, she has mild COPD and takes Symbicort. And 3, the cough keeps her up at night. Interesting. Okay, cool. Now, other questions that we can also ask as well is she a smoker? Does she have any family history of this? Any mucus, any color to mucus? Any other history of these kind of coughing fits, etc.? Now, after asking that, we do learn that she wasn't a previous smoker. Quit 10 years ago. Okay, cool. So what do we do in this case? So she's got, after asking the question, she's got a cough, she's got fatigue, she's got congestion. So after delving into her case, she's got that 6-day cold and flu. She's got mild COPD and she's got Symbicort inhaler. Her coughing is keeping her up at night and she's an ex-smoker. She quit 10 years ago. Now, in terms of solutions, this one's going to be a very interesting case. So COPD stands for chronic obstructive pulmonary disease. Generally speaking here, this is a lifelong condition. Now, it's really, really important that when it comes to anyone with COPD, you have to understand that their respiratory system is more or less compromised compared to the average person. The muscles in the bronchioli and in the alveoli are much weaker, much more fatigued compared to a normal set of lungs of the same age. So their capacity and their ability to recover from a very, very basic cold and flu will be stretched out for much longer than a normal person. So in terms of solutions, this one's going to be a little bit different. So generally speaking, if you do notice that the cough is more mucousy and it's more boogery and phlegmy, then what we can do just to be on the safe side is that we can recommend a chesty cough liquid. Now, one that comes to mind would be like a bromhexine. Now, this one's going to hopefully break up phlegm. Now, that one is usually depending on the formulation, but generally speaking, it's usually 10 to 15 ml every 4 to 6 hours. And in terms of the second most important thing is to reinforce inhaler technique. Make sure that she is using it properly. Ensure she is using it properly. And counsel on side effects of Symbicort. And the third step would be to refer. Refer. Now, reason why, because we have that history of COPD and the cold has been more than 3 to 5 days. So what that could mean is potentially secondary infection, which means needs antibiotics. Cool. So that one's a very interesting case because not is it necessarily just testing you on your ability to ask questions and get information from your questioning, but also is quizzing you on your ability to counsel on existing medications and incorporating a more of a holistic approach to treating her. Now, in this case here, we didn't have to necessarily give her any cold and flu recommendations, but we did give her something just to ease that cough and to hopefully reinforce her technique of her inhaler, and also referring her on to the GP, just because in COPD, they have a higher risk of getting secondary infections like pneumonia. So we want to make sure that she's getting taken care of and do a test, either a swab test or probably get that cough tested as well and sampled, just to make sure it's not something else like pneumonia or any other lower respiratory or upper respiratory tract infection. All right, fantastic. That's it. So essentially that we just cover 3 really good cases. 3 cases that cover different types of cold and flu scenarios, one that are very basic, one that might be a bit more advanced, a bit more involved, and a third one that is more testing your ability, not just to be able to recall products and names and doses, but to be a pharmacist in the sense that you can be holistic and give a more human response where you're not necessarily just recommending products and solutions, but you're also giving lifestyle advice and genuine advice for patients to really optimize their healthcare, no matter what age and what situation they might be in. Now, if you're interested in that kind of content and you want more, just let me know in the comments what kind of topics you want me to cover. However, if you do want to be more involved in terms of getting your internship under wraps and making sure that you can really launch your career to the next level, make sure you join the PharmWise community that I have linked in the description. So that is a intern-only community that has about 80 or 90 interns at the moment from all over the world. The whole idea here is that we want to connect with one another, not just so we can get ready for the exams, but we want to make sure that we're career ready. We know how to honestly open a pharmacy by the next day after registration. I want you guys to be the best possible pharmacist you could possibly be, so you can really launch yourself into the right direction, no matter which way in pharmacy that you choose to go. Now, if you have any questions, please feel free to let me know in the comments. Let me know what you thought about the video. And if you want more content, please subscribe. Why not? Share the video around to your friends. And I'll probably see you later in the next one. Have a great one. Bye.